new patients come into the practice, I really want to put them at ease. When you're a younger practitioner, it's really tooth-focused. You quickly learn that it's really just about people. You're providing a service that they need, and it's intimidating to some people. They're worried about the expense. Some people have anxiety about it. I really let them know that the only reason for me to be here is to serve them. And we really try to talk about that, not just Dr. Fanger and myself. When we have meetings, we talk about our patients is the only reason for us to be here. And it's not really about their teeth. It is, but it's more about who they are. So we spend a little bit of time, just ask them like, well, how'd you end up in my practice? And what would you like us to do for you? And some patients have really direct ideas. Other people are like, well, I thought you would tell me. So then we just ask more questions because we'll find out really what they want. Really, the most important part is to find out what the patient wants first. And then you do an assessment and let them know what you find. And it's kind of just a collaborative approach. And it puts patient at ease when you don't just give them a big list of problems. For us, we call them issues, and all those things have solutions. So we focus more on that aspect. So when somebody walks through the door, I would love for them to walk in. Our office is fairly newly remodeled. We put couches in and pillows, and it doesn't really look like maybe a typical dental office reception area. We don't call it waiting area. We call it a reception area. We want people to be welcome. We've changed the front to where we have a concierge person in the front who's a greeter. I would really like, it might be a cliche, but I'd like them to see somebody smiling at them coming in and feeling good. Because, when you smile at somebody, and if you smile yourself, you can't help but feel better. And people come in with all sorts of things on their mind. They could be nervous about the procedure, or they're just like, hey, I got to go to the grocery store, so let's get this done. And so we just want to put them at ease, take care of them. I would like them to just feel very welcome. And right from the start, know that they're being focused on as an individual and that our purpose is to serve them.